The UN's World Food Programme says that 500,000 children in southern Madagascar are facing acute malnourishment. UNICEF says that this will be a fourfold increase since the previous assessment conducted in October last year. UNICEF and the WFP said in a report that more than 1.14 million people are food insecure in southern Madagascar. The UN says that 5 straight years of low rainfall has wiped out harvests and reduced access to food for many in the worst affected regions. 3/4 of the population have been affected by drought and COVID-19 infections, aggravated by poor health and sanitation facilities, as well as a lack of safe drinking water. Earlier, I spoke to Tim Irwin, who's the UNICEF Chief of Communications in Madagascar, about the situation in the southern part of the country. Tim Irwin, Chief Communications Officer for UNICEF in Madagascar. Thank you very much indeed for joining us. Welcome to the program.
Thank you. Great to be with you.
Perhaps we can begin with the devastating situation that's been brought on by 4 years of continuous drought. What are you seeing on the ground as a result of this?
Well, as you say, it is a devastating situation, and what we're seeing on the ground is really a humanitarian crisis. We as UNICEF are primarily concerned with the health and well-being of children. And we issued a report recently saying that there is a projection that up to 500,000 children could be acutely malnourished by the early months of 2022. And that's a quadrupling of the number of acutely malnourished children that we saw at the end of 2020. So it really is a very alarming situation. As you say, it's an area which has been hit by severe drought for many years. It's the worst that it's been in a very long time. And, when you have drought driving the crisis, you have all kinds of other impacts. Malnutrition, of course, is one of them, but clearly there is a lack of access to potable water, and that drives all kinds of illnesses, as you can imagine, particularly amongst children. People who were able to grow their food previously are no longer able to do that because their fields have turned to dust as a result of the drought, and which is largely being driven by climate change. So there is a lack of food, there is a lack of access to water, there are high rates of malnutrition amongst children, and there is really a desperate need for assistance, which we and partner agencies such as the World Food Programme and, of course, together with the government of Madagascar are trying to do. But more needs to be done, there's no question.
Your focus is definitely on the children. What are some of the effects of malnutrition that you've already started seeing amongst the children?
Well, I mentioned that figure of about 500,000 children who are projected to be acutely malnourished. There are different types of malnutrition. There is severe malnutrition, and that is a life-threatening disease. And of that 500,000, we estimate that about 110,000 children will be severely acutely malnourished. And these children, if they don't receive treatment, and that is normally in the form of therapeutic food, people may have heard of a product called Plumpy Nut, and it's essentially a peanut butter paste, but it's very fortified in nutrients and high in calories. And if these children are treated, 80+% of them recover. But if they aren't treated, they are at high risk of dying because they're vulnerable to, their immune systems are weakened and they're vulnerable to all kinds of illnesses such as pneumonia, diarrhea, and others. So it is a situation which we urgently need to address.
A situation you need to address. What have you been able to do, and what do you need assistance with urgently?
We need assistance with funding, and I know this is a tried and true response, and I think people perhaps sometimes get a bit cynical about it. But without funding, there's nothing that we can do. But having said that, we are on the ground. We are working together with our partners. We have treated around 80,000 children, 35,000 of them, as I say, suffering from this very severe form of malnutrition. So there is a response on the ground. We just need to increase what we're doing. I know our partner agency, the World Food Programme, needs to work on providing food assistance to families. There are other things which we can do as well, which is provide access to safe water. We are actively involved in bringing water via trucking to families who are really in a desperate situation. They're using whatever water that they can find. And we're also working on cash transfers to families so that those individuals, those family members, if they receive the money, they know what to do with it, and they can help sort themselves out. So it's a multi-sectoral approach. It's not just about malnutrition, because everything, all the drivers are there, which is really coming together to create this perfect storm.
The most vulnerable children, age range, is it very young children?
Yeah.
Who are you worried about the most?
Children under 5, and that's really our target group. So it is very young children, as you say. We have chronic malnutrition throughout Madagascar, and what that means is that children are perhaps eating enough, but they're not eating a varied diet, and so they're not getting the nutrients that they need. And that affects their physical development, and that affects their mental development. We estimate that more than 40% of children in this country are chronically malnourished. But as I said, what we're particularly worried about is this severe levels of malnutrition. And that's where you see children who are really wasting away. They're terribly thin. I mean, one of the ways that we test for severe malnutrition is the upper arm of a child is measured, and there are 3 levels, green, yellow, and red. And when that band shows the child to be in red, we know that they are very sick and very much at risk, and they need to be put on this therapeutic food, plumpy nut, immediately. And it's a course which lasts for weeks, sometimes for more than a couple of months. They come back to if they're not suffering from other ailments, they come back to the clinic every week to be monitored, have their progress checked, and receive additional sachets of this food.
The parents of these children must be pretty desperate. What have they been trying to do to keep their children fed and alive, given the meager resources available to them?
They're foraging, but I was down there not too long ago, and, they go out in the morning and they might take fruit from cactuses. They might take whatever they can find from trees. I mean, maybe they'd be lucky if they were able to find a fish. I mean, their livestock is largely gone. As I say, their fields have largely been destroyed. I know other UN agencies have been providing some form of food assistance. More needs to be done. I mean, that's not a long-term solution, obviously. I mean, what we need to do is create a situation where these families are able to cope and look after themselves. And I know that's what everyone is working towards. But when you have a crisis, you need to respond as quickly and as thoroughly as you can in order to give people the ability to get through it and hopefully come up with more longer-term solutions.
In some of your press releases, the word catastrophic conditions is used. And, sometimes this word can be overused, but one gets a sense that this is really what's happening on the ground. And I just wonder, are we talking about famine and starvation?
We're not talking about famine at this point. There are ratings, there's a science associated with this. But you're right, we have at the moment about 14,000 people in one region of southern Madagascar, which are in what we would call a catastrophic situation. And that's a step away from famine. So what we would say is they are living in famine-like situation, but to declare famine, there are certain criteria that need to be met. And we're not at that stage yet, and we obviously hope to avert that. But it's a desperate situation, and the fear is that the number of people living in these catastrophic conditions will increase. And that's why we and other UN agencies and the government are on the ground trying to do everything that we can and looking for additional support so we can step up the response.
On top of this, we're also hearing that food prices have been going up as well. So it's drought, it's hard economic conditions, it's COVID-19, and food prices that are making it difficult for many families just to get basic food security.
That's absolutely right. And then food and water prices, right? Because most people are having to buy their water. There are private vendors of water, and the price of water has gone up. I mean, that's sold by the jerry can, as you can imagine. And so, many people don't have the means to go to the market and buy buy food, I should say. Normally, they would find that for themselves. They would grow it for themselves. But now they're foraging for it for themselves. But obviously, you can't survive without water. And so that is a crucial element in the response, because, if you have families and they're just scavenging for water, if you will, they're taking whatever surface water they can find. And I've been down there and I've seen people filling up their jerry cans from little ponds where there are cows and other livestock right next to them also drinking. It's water which you or I would never think of consuming, but they're desperate. They have to drink something. They almost certainly know that it's going to make them ill, and it does. And so that they end up in these clinics, and a child who is vulnerable to malnutrition then becomes even more at risk. So yes, absolutely. There are so many elements to this: food, water, livelihoods, malnutrition, and of course education. The future, a child's future, and the future of that child's community and family is very much dependent on education. And as you can imagine, when you're in a situation like this, there's a greater risk that children who are in school will be pulled out and put to work in some form or another, or made to stay at home just to help the family scavenge for food. So, families need to have the means to release their children from that, if you like, and so that they can allow their sons and daughters, particularly their daughters, to go to school. So emergency access to learning is another aspect of this response.
Have you been able to reach everybody? I know that Madagascar has quite a large rural area, and I would imagine that access to some people might be difficult.
Absolutely. I mean, the road conditions down in the south of the country, where there are roads, are terrible. I mean, getting from one point to another can take hours, and that's in a 4x4 vehicle. I mean, most people are getting around on foot. So no, you can't reach everybody. It's just impossible. But what you need to do, and the other thing which we're active in doing, is working on communication with communities so that they know what's available. That might be for an upcoming vaccination campaign, for instance, or it may be for, food assistance deliveries, and it may be for, how to prevent your child from becoming malnourished. And if they are malnourished, where you can seek assistance. So this kind of what we call communication for development is another aspect of the response. Communities need to have the information. These families, these mothers particularly, will walk for hours in order to reach assistance. But they just need to know where it is, and they need to know that their ill child can be helped.
Or perhaps as a final message, what is your message to the international community? How can they help?
I think, in situations like this, you don't want to create an image or a situation where it seems hopeless, because when we talk about treating malnutrition in children, I've seen it here in Madagascar, and I've seen it in other countries as well where I have worked. You can see a very, very ill child, someone, a very malnourished child doesn't cry, for instance. They just sit there looking totally forlorn and listless. But you get them on this plumpy nut, on this therapeutic food, and they come back to life. It's quite remarkable. And so I think the message is the situation is dire, but there is a response, and we just need to increase the response in order to save lives.
Tim Irwin, Chief Communications Officer for UNICEF in Madagascar, thank you very, very much indeed for joining us on the program. And we wish you well with this emergency to help the children of Madagascar.
Thank you. Good to talk to you.